Good afternoon, everybody. This is Dr. Chris Ebert Santos at Ebert Family Clinic. It's September 1st and school has started. I wanted to bring in some impressions and updates from my recent involvement in the Second World Conference on Advances in COVID-19, along with my friends from all over the world. This conference was organized by researchers in India and Bolivia and featured many scientists covering everything from vaccines, epidemiology, and treatment of COVID. My presentation was COVID conundrums clinicians encounter in kids. We haven't had pediatric cases admitted to our hospital here, but I did an extensive review of the literature and was able to share the information with these researchers, and now I will share some of it with our community here in the mountains. We have talked in the past about the Miss-C syndrome, which is an inflammatory disease that shows up 2 to 4 weeks after a COVID infection. The specialists at Children's Hospital in Denver have only had about 5 cases, so this is not a big issue for us, but it does present with fever, nausea, vomiting, abdominal pain, rash, cough, runny nose. And as you can see here, it's very difficult for us clinicians to differentiate between COVID positive, COVID negative, and Miss-C cases. This study of 192 children was done at the Massachusetts General Hospital. They enrolled children from ages 0 to 21 who had symptoms that could be consistent with COVID. Out of that 192 children, only 49 had a positive COVID test. That meant that 3/4 of them did not have COVID, as could be proven by any kind of test at that point. Now, when you compare all the symptoms that they had, you can find that the percent with runny nose, or headache, or sore throat, and particularly cough and fever, and even shortness of breath is pretty much the same between your random viral illness out there and a COVID positive case, and even the Miss-C inflammatory syndrome. So that means that us as clinicians are being asked every day to decide who can go back to daycare, who can go back to school, on the basis of information that we really don't have. We don't actually trust the testing 100%. So we're back to using our just clinical experience and assessment of the patient in the old-fashioned way. So what I would like to say about this is it is important for us to look forward to a vaccine. And the vaccine probably will not be tested in children for the next 2 years, because children are not the ones who are becoming very ill with this disease. In the meantime, everyone's learning about all of these scientific procedures and testing and vaccine development that you've never bothered to really study in the past. And the reason that's relevant to us here in Summit County is that Ebert Family Clinic was selected to do a phase 3 vaccine trial by the Pfizer company on a very common childhood vaccine we've had for 20 years called Prevnar pneumococcal vaccine. And this is actually an improved or enhanced, expanded version of this vaccine. Instead of covering the first 7 serotypes, it expanded to 13, and now it's expanding to 20 serotypes. So we are encouraging families who will have a baby between the ages of 42 to 98 days in the next 5 months. If they're interested in participating in this study, they will be part of scientific advancement, and they will learn more about vaccine development, which may be relevant to them in making decisions in the future when we are developing a coronavirus vaccine for children. Call our office, 970-668-1616, or go to our website for more information. And don't forget our blog, highaltitudehealth.com.